Good morning and welcome to a special edition of Managed Care TV. I'm Steve Thornley, CEO of CareNational and your host of Managed Care TV. Today we have a very special topic, and that's why we're running this special episode here on a Friday, because we're going to be talking to Mr. Dale Bellis of Liberty HealthShare. Liberty HealthShare is an alternative to traditional health insurance and another option for consumers. Dale, welcome to Managed Care TV.
Sure, it's a delight to be with you, my friend. Thank you for the invitation.
Okay, perfect. Well, thank you so much for joining us. And, we're real excited about this topic. One of the things that I get excited about being in the healthcare recruiting business is that there are a variety of ways that you can take care of your medical care expenses. And so we started talking, I don't know if you caught any of our premiere episode where we spoke with Dr. Josh Luke, but he actually, I had actually asked him a pointed question about health savings, or I call them co-ops, if that's a proper term. Would that be an okay term?
Well, a co-op, frankly, is a creation of the Affordable Care Act.
Okay.
And so we're a healthcare sharing ministry,
okay,
is how we're designated in the ACA.
Okay. Dr. Luke, who we interviewed last week, is he's a healthcare futurist, and when we started talking on this subject, he brought up something that I think is on most people's minds when we talk about health sharing, and so we kind of want to play that clip for our viewers, if you don't mind. And I think
I'll be happy to.
One of the other avenues I just wanted to discuss with you that we talked about before we agreed to have you on the show is the emerging co-op model, where you've got these organizations. I know there's a lot of religious-based of co-ops. Talk to me about a co-op. What are the advantages and disadvantages of an employer actually looking to go the co-op route?
What about these co-ops? The co-ops are now more in play because you as a small business owner, right? And even if you're a mid-sized business owner, when you say, hey, we're going to have a meeting and offer 6 options this year. If you're a Christian, we're going to offer a Christian co-op, and we're going to fund $200 a month. We're just going to pay it to you via salary. That's up to you. If there's co-ops that aren't Christian, I just in the book, I think we talk about there's a new Jewish co-op, healthcare co-op that's coming up. There's all these what I call alternative insurance models. And so the answer to your question is, are they legit? Yes, but there's no guarantee that your expenses will be paid. So in most of them, you have to pay up front and then ask for reimbursement. You have to be an active participant in the religion or in the organization. You can't just sign up and say I'm a Christian and sign up for a Christian co-op. They want you to walk the walk as well as talk the talk. So the co-ops are going to become a lot more into play. The nice thing is they're not regulated by the insurance commission as much as the insurers certainly are. So I think they're going to get a lot more focus in coming months for sure.
So Dr. Luke, Mr. Bellis, looking at that interview, how would you respond to Dr. Luke's comments about things may not get covered in a health share program? Because we know that it's not insurance, correct?
Right, it's not insurance, and in fact, we revel in that fact. We don't want to be insurance, and we really want to base our association together on a voluntary and cooperative basis as self-pay patients. That's what gives us maximum freedom to manage and direct and control the care of our own health. We just simply choose to share those costs in community with one another. And the law of large numbers permits us to do that. And so we, at our current share amount, it's been adequate to meet every medical bill ever presented to us for those that are eligible expenses. And we have our set of guidelines. Our members cooperate and create the kinds of rules that we follow in terms of the medical bills we will share in. And we've never had a medical bill submitted that was eligible for sharing that ever went unmet. But that in itself is obviously a encouragement or a comfort to those who wish to come join us. The reality is we don't want to be insurance. because our association is based upon our shared value or shared belief. That's the glue that holds us together and enables a member to participate month to month. And that is our shared beliefs. They're on our website. But the most important one being, we really believe God has placed us here on earth to use our time and resources to assist another person when they're in need. If you're the kind of person that drops money in the Salvation Army bucket or participates in fundraisings and charity, that's the impulse that holds us together. We've turned that principle into a solution for healthcare. That's why our members participate every month.
Okay. Well, and so that question is going to come up is what, people might inquire and say, well, give us an example of a catastrophic event that you've covered under the HealthShare program.
Sure. In fact, I'll give you an example of a member family who joined within 2 months after they enrolled with Liberty HealthShare. Their 15-year-old daughter had a hemorrhagic stroke. They were absolutely devastated. She was in intensive care and went through major treatment at a local hospital because of the emergency. They had $500,000 of medical bills. And in fact, the hospital administrators panicked a bit. They came to their room. His name is Chris. His daughter is Anna from Phoenix, Arizona. Chris relayed to us, they came to their room a bit panicked because they couldn't quite grasp how a methodology that was not the typical third-party payer, how that was going to work for them in that particular setting. They explained Liberty HealthShare and healthcare sharing. We obviously came to that member's assistance and aid, and it works this way. You're familiar, I'm sure, with crowdfunding. It's similar to that, but our members participate every month, and we assign a specific expense that they're participating or sharing in. So a sufficient number of members, we assign their share amount to Chris and Anna's expense at that hospital, slash that bill in half as a result of our intervention and advocacy, met that payment in full. And in addition to the financial transaction, here's what's key. It's not just about paying the bill. We reach out to our members in both emotionally and spiritually to support them during those times of crisis. So hundreds of our members who were assigned to their bill messaged them with cheer and encouragement, even prayer. And they expressed to us how meaningful that was, especially in that crisis with their young daughter. And today she's recovering, doing well. And that family is incredibly grateful for the participation of members all across the country who helped pay their bill.
That's wonderful. And how many members do you have?
We presently have 92,000 households. And by household, that can be a single, a couple, or a family of 3 or more. So mom, dad, and all kids. But that represents 230,000 members. And so at our current amounts that we assign to singles, couples, households, I can run through that in a moment, but we are sharing among the members $22 million of medical bills every month.
Wow, that's wonderful. What's your growth rate since the ACA passed, and has it slowed at all since the mandate has been removed?
It has not slowed since the mandate change, but we've grown. We launched in 2012 as a reorganization, a relaunch of an existing healthcare sharing ministry that had been in place since '95. And we relaunched as Liberty HealthShare, began adding members in 2013. And we've grown, obviously, since then, as I mentioned, up to 92,000 households. But we add on average about 3,000 new households every month. And that expands even more during that period we've gotten so accustomed to, that's referred to as the open enrollment period. We're not subject to open enrollment because we're exempt as a healthcare sharing ministry from both the mandates to fulfill under the ACA, as well as the fines. And so we're not subject to that open enrollment period, but folks have gotten used to making changes in their healthcare lives during that period. So we typically see a spike in November, December, January, but on average, 3,000 new households every month.
We're going to talk to actually one of your members here later in the show, and kind of excited to get their perspective. But from your perspective, what's your typical household? What is their situation that drives them to take a serious consideration in using a health sharing process or organization?
We've surveyed our members, and it's typically this. It comes to the number one reason that catches people's attention is the difference between our health share amounts and what they're paying in the marketplace for a third-party pay system like an insurance policy. So they see that distinction and difference, and that's what catches their attention. Then they begin to investigate, get educated regarding how healthcare sharing works. And the second most frequent feedback we get from our members is the fact that their money is going to another person. That is, every month we ask our members to set aside, it's $199 for a single, and these are our current share amounts, $199 for a single, $299 for a couple, $449 for a family of 3 or more. We don't count more than 3, so mom, dad, and all kids. That goes into a secure online account. We call it our share box. And through our proprietary online software, that money is then matched to another person who has medical bills. And you transparently, openly see your dollars flow from your online account to the receiving member's account. You can message them with cheer, encouragement, prayer, and then we cut the checks directly out of that receiving member's account to pay the doctors and the hospitals. And that's what our members relay as being one of the top reasons they love it so, because their money is going to another person, a real live, breathing human being who has an expense that they're participating in. And then that entire community and membership is there to assist me whenever I have a bill.
And I saw you in another interview, actually, where you addressed things that you wouldn't cover through HealthShare due to kind of an ethical or value base that you, or creed that you have. Can you talk to those situations?
Sure. We are a safe harbor for those who have conscience objections to many of the mandates of the Affordable Care Act. We're all familiar, of course, with the Little Sisters of the Poor case, or Hobby Lobby, or Conestoga Wood, that were contested because of the mandates of the ACA that required people of faith and values to use their money in ways that they objected to, whether that was the most egregious example, of course, being abortion or abortifacients, or other high-risk lifestyle costs that we do not share in. That's number one. Number two is our philosophy has always been that we are here to assist with those things that are unexpected and unaffordable. So if you can plan for it, budget for it, set money aside for it, let's do so. So we're taking care of the small costs, but we're here to assist with those things that are unexpected, unaffordable. For instance, we don't participate or share in dental expense. I guess it's possible to have a $5,000 toothache. It's unlikely. You can sure have a $5,000 visit overnight to the ER. And those are the kinds of costs that we focus on. So dental or eye care or a hearing. We give our members, by the way, a discount card for those kinds of services. So they're paying less than some of the marketplace rates. But those are not eligible expenses. We pay for those out of our pocket. The other thing we don't share in is what we call our annual unshared amount. That just simply means because we're self-pay patients, there's no contract of indemnity between Liberty HealthShare and the member. We're sharing voluntarily and cooperatively. We're responsible for the care that we access as well as the costs. We just simply choose to share those expenses together. And we deduct away from those expenses the first $500 if you're a single, 1,000, twice that for a couple, 1,500 in our membership year for a family. So that's the amount we pay for out of pocket in our membership year. And then whenever an incident occurs, I have a heart attack, then we begin sharing 100% of those expenses up to $1 million for each incident. An incident is a designated or a diagnosed condition, a heart attack. You have kidney stones, all the doctor visits and medication and surgeries associated with that condition up to $1 million. A broken arm the same way. And that's the way in which we meet those costs.
And is there information on your website or publishing that people can find that shows kind of what your reserves are, or is that a number you don't broadcast out to the world?
Yeah, excellent question, because that's the distinction between healthcare sharing and insurance. We're prohibited, because we're not insurance, of having reserves. We just literally take all the medical expenses submitted by the members every month, divide it equally among all the households, and everyone's share amount then pays those bills that month. And so it's month to month. Our share amount has stayed the same over the last 3 years. So we haven't adjusted or changed that amount. That $199, $299, $449 has been adequate to meet expenses every month. Now, expenses fluctuate, flux and flow. Our goal is to end the year flush so that all the bills are paid, and that's the case. And we turn that around every 30 days. So the reserves truly are in the pockets of the members. So if we would turn to our members and say, there's a trend of increased expense, we're all subject, everyone else is, to healthcare inflation. We see a trend, we need to add $50 to our share amount to meet that trend. Or there's a spike, let's just give it a little extra this month. And we've not had to do that over the course of the number of years. We probably are going to have to adjust our share amounts because, as I mentioned, we're subject to the healthcare inflation like everyone else, but it's been adequate for the last 3 years, and our share amounts every month clear the decks, so to speak, every 30 days.
So there's critics that might say, well, one or two big catastrophic events could basically dry up this company and put them in insolvency. And I think what you're saying is, and correct me if I'm wrong, that the members would come to the rescue in a situation of an extreme catastrophic event, and basically the money would be available to cover anything that you would accept as a catastrophic event. Is that correct in stating it that way?
Well, yeah, as I said, we're currently sharing at 20 to 25 million every month.
Every month.
That's
okay.
Our capacity to meet medical expenses.
That's pretty
as
good.
A sharing group. And so we are meeting those costs month to month. So the law of large numbers is such, we're more than adequate to meet those catastrophic expenses. And if we did need to turn to the members and say, we got a spike, we just need to contribute this amount, they respond overwhelmingly positively and do so because we're dealing with actual expense, not projected or anticipated expenses. It's a post-assessment. So when the bills literally arrive, we make adjustments to them as to what's fair and reasonable. It's typically 50 to 55% that we save for our members through the methodology that we utilize. So we're not only discounting those bills, our members are health conscious, and health conscious people have fewer bills, less costs, go to the hospital fewer times, recover more quickly. So our trajectory is down, and we access deep discounts in the marketplace. So for all of those reasons, our health sharing amount has been adequate month after month.
That's wonderful. And of course, I think I'm asking the questions that everybody that would investigate this would want to know.
Well, absolutely. And in fact, I would say there is a audit. We have an annual audit with an independent auditing firm under typical GAAP standards. And we present that audit every year. It's there on our website, so folks can see both in terms of what it costs administratively to operate the program. I can address that in a moment. And then the amount that the members have shared in terms of medical expenses, and the way in which we meet our bills after a person becomes a member within the first and second month comes to us administratively. But every month, beginning in month 3 and following for the duration of their membership, whether it's a single or a couple or a family, $24 goes to meet our administrative expense. And so that's the amount that just, again, transparently in your share box, when your dollars are distributed, you see that $24 go toward admin, the balance then to the sharing program.
Mr. Bellis, we're going to pause for just a moment and take a quick break, but we'll be right back to talk to you about some more questions I've got up my sleeve here on Managed Care TV.
You can be told to run, or you can choose to run. Both get you moving, yet one just goes through the motion. The other has purpose, meaning, freedom. What about your health care? Are you being told, going through the motion? Or are you choosing something better? Liberty HealthShare has a purpose. It unites people to share in the burden of healthcare. A true community that cares for you in your time of need. Free from interference and constraints that gives you back the power of freedom. It's time to exercise your purpose. Time to exercise your meaning. It's time to exercise your freedom. Liberty HealthShare.
So it sounds to me like you have a very open book policy with your members. There's no, no hidden ledgers, I guess, so to speak, in the way you conduct your business.
Because we do it all online, every month the member sees exactly how their dollars are distributed and utilized. If we need their full share amount that month, they know exactly who it goes to. If we don't need it that month, it accumulates to the next and to the next until we do need it. And they see that happen in their share box every month. Complete openness, complete transparency.
I've got to ask you maybe a difficult question, but it's coming to mind. You are a faith-based health sharing program. Do you feel that you're being exclusionary by only adding people that mirror your? Is it more Christian? Are there faiths that you exclude if you know somebody's of a certain faith? Or talk a little bit about that, because I'm sure that's come
well.
up
That's an
before.
excellent question. That's not a hard one at all, because it really goes to the core of the who and what we are. We are based upon our shared values and faith beliefs. But those faith beliefs, we do not intrude on individual faith choices. We don't ask what your doctrinal statement is, what church you attend. We are unabashedly a Christian ministry, and our shared beliefs are there on our website. That's really based upon what we believe are our God-given rights to manage and direct and control the care of our health. But there's 5 shared beliefs. Folks need to review them, see if that is reflective of their values and beliefs as well. They're general, broad-based Judeo-Christian values about healthcare. And they sign off on it and say, yeah, this is reflective of me. So we're not looking to exclude, we're looking to include as many as who will join with us in our cause, which is meeting other members' healthcare bills based upon those shared values.
Well, let me hear your 2 to 3 minute pitch to somebody that's struggling with the health options that are available to them. What are your bullet points? excuse me, that would attract somebody to really take a leap of faith, really, because most people are used to customary employer-provided health insurance.
Yes.
And now this is sort of breaking the mold and taking people out of their comfort zone. So how would you address that with people?
Yeah, I've been a healthcare administrator for well over 30 years. Administered self-funded employer plans for a long time, and had my own third-party administrative system company as a TPA, and administered employer plans. My observation was that in our American healthcare system, there are two fundamental flaws. We've been subject to skyrocketing prices, more intrusion, frankly, in our lives, greater administrative red tape, all of those issues relative to our current healthcare system. And my observation has been two major flaws. The first being the third-party pay system. That means somebody else is paying the bill. I send my money away to an insurance company, or the employer provides it for me, or the government pays for it, but it's coming from somebody else's pocketbook other than my own.
Sure.
That produces an entitlement mentality. In fact, not only do I not know about the costs ordinarily, I'm insulated from the costs. Somebody else is paying the bill. Now, that will work only so long as the money in the other person's pocket lasts. But that's the crisis that we're encountering in our nation today, is the third-party pay system has created these skyrocketing costs and prices, not because that's what it costs to access care. It's because all of the middlemen and all of the administrative costs and all of the added in intermediaries that create that kind of system is problematic. That's number one. Number two, that third-party pay system has also produced what I call a sick care system. That is, the entire purpose of the healthcare system today is to treat me if I'm ill. And the economic advantage to the hospital or the doctor is the more times they see me when I'm sick, that's how they get paid and reimbursed. And I began to research that in the passage of the Affordable Care Act in 2010 and said there's got to be a way for the ordinary American to meet healthcare costs without that kind of intrusion and administrative complexity. And so through a couple of decades of experience with healthcare sharing back in the 90s, with self-funded administration in the 2000s, we launched Liberty HealthShare under those principles. And it's based upon three things: personal responsibility, the belief that I live in community and need to help others, and they in turn will help me, and a focus on the care of my health. That is a health consciousness. Not that we're all healthy, but we're on the pathway to health and wellness. Those three principles is really the foundation on which Liberty HealthShare stands, and that's the way we exercise our healthcare freedom.
Well, thank you for summarizing that. And tell me, just in your opinion, in 5 years from now, where do you see your organization growing to? What's your predictions?
We're just knocking on the 100,000 member door, and I anticipate a continued expansion and growth. We've been kind of growing like a prairie grass fire. Continued growth and expansion. My vision and hope in the next 5 years or 10 is to be a million households strong. And I really believe that prospect exists for us, that really delivers healthcare freedom and opportunity and choice in America. Now, I don't believe that we're the answer to everybody's healthcare expense, because we are very much focused on the faith-based community and taking personal responsibility. Not everybody fits that profile, but it is one of the choices that I believe will produce reform and change and alteration of our current healthcare system, because I believe the most impactful way to bring about change in healthcare is from the bottom up, the individual customer beginning to set those parameters. Because in our case, it is our money at stake. It's coming from our pockets and the pockets of our fellow members. That changes one's mentality. And so as I look down over the next 5 to 10 years, I really believe it will become a major force in the change of healthcare in America. And we believe it's a change for good.
Dale Bellis, Executive Director of Liberty HealthShare, we appreciate you joining Managed Care TV today. And coming up, we're actually going to talk to one of your members about their experience. I understand that this young family here in Arizona is a relatively new member of your organization, but I've got some interesting questions for them, and it'll be nice to see their perspective as well. So we appreciate you coming on the show.
It is such a pleasure. Thank you for the invitation. Enjoyed being with you.
You can be told to run, or you can choose to run. Both get you moving, yet one just goes through the motion. The other has purpose, meaning, freedom. What about your health care? Are you being told, going through the motion? Or are you choosing something better? Liberty HealthShare has a purpose. It unites people to share in the burden of healthcare. A true community that cares for you in your time of need. Free from interference and constraints that gives you back the power of freedom. It's time to exercise your purpose. Time to exercise your meaning. It's time to exercise your freedom. Liberty HealthShare.
So we're talking with Sarah Knopp, and Sarah and her family recently joined Liberty HealthShare as an alternative to traditional insurance. So Sarah, welcome to the show.
Thank you.
We want to talk about, what kind of put your family in this position to look at some alternatives. So can you give us a little background as far as what was going on with you and your husband and your family on looking at alternatives to health insurance?
Yes. So we have seen a significant increase in the cost of insurance over the years, to the point where at one point my husband was working 2 jobs, a second job, so because their benefits were better. So he worked there just to get the benefits, because they were a little cheaper with a bigger company. And after, during that time frame, I went through cancer treatments, and he went through a thyroid disease. And so we really needed the health insurance for that, for all of that. But in a nutshell, through all of that, it was kind of drowning us. We had 4 kids. He's working 2 jobs. I was a piano teacher and also trying to go through cancer treatments, and we were like, hey, we can't do this anymore. Like, something's got to change.
Sure.
So we kind of made some changes in our life. We switched and just decided we'd just deal with paying for the more expensive premium that we were paying through his main job, which was with a construction company. And and over the years, we watched it go from, and I'm sorry I don't remember the exact numbers, what it was when we first started with their insurance, but it was probably around $500 a month, which felt really expensive to us, to over $700 a month.
Wow.
For our family. And this was a plan that was considered a major medical plan. It had a $5,000 deductible per person, no family maximum.
Wow.
So we were paying over $700 a month for that. And then while we were paying, we did that for 2 years. The second year we had a baby. And so we had our 5th child, and we met my maximum. We met her maximum. And then my husband also had surgery that year, so we met his maximum. And so we paid $15,000 in out-of-pocket cost, well, just to meet our deductibles.
Oh, my goodness.
And then we had to pay 20% on top of that.
Wow.
So at the end of that year, I just said, what are we doing? Like, this is crazy. This is cost. Like, it would be cheaper to not have insurance. We could have paid cash for everything we did and had it be cheaper than $15,000.
Sure.
And so we decided to go without insurance for a little while and just pay the fine that you have to pay for not having it.
For the Affordable Care Act.
Yes,
Okay.
because that was cheaper, and then pay cash for everything. Because we needed to catch up. We needed that $700 a month to pay off all our medical bills that we had from the year before.
Sure. Yeah, I totally understand that.
Yeah, so that was just a hard year for us. It was really hard for me to swallow that. Why did I pay $700 a month for something that really didn't help me?
Right.
And so then we started researching options because we thought, okay, well, we can't be without insurance because that's a huge liability. We've got 5 children. So that's when I started hearing about HealthShare. So we went ahead and decided that we would try this. So it is it's significantly cheaper, the cost per month. It's not really a premium, because it's not an insurance. But the shared amount per month is significantly less, almost half, not quite, but almost half what we were paying with my husband's company. And then they have a $1,500 unshared, which is kind of similar to a deductible, per family.
Okay. And
that's significantly less.
Absolutely. And one of the things we understand from interviewing Dale Bellis, who's the executive director, is that you actually can log on to a website and you can actually see the person that you're helping share the cost with. Is that been your experience?
Yeah.
Okay.
Mm-hmm. Yep, I can see that.
Give us an example. Does it show what the ailment is, or does it just show you're helping so-and-so in this part of the country?
I don't believe it showed the ailment, but it did show an amount.
Okay.
And yes, the part of the country and their name.
If you had any trepidations about going away from conventional health insurance and obviously the worst option of not having any sort of health coverage, what were your trepidations about joining a HealthShare, if any?
I think my only trepidations are making sure that our expenses really are covered. Because in my experience so far, now we really did not use it at all last fall. We just didn't need it. We didn't ever have a reason to need it. But this year we have had multiple things. You just never know.
Sure.
So we've had an ER visit. We've had an ER visit with my 3-year-old that looks like it's going to be in the $5,000 range. It's been fairly recent, but we did not find out till, it's the middle of the night, until at the very end of the visit that they're not even willing to bill Liberty HealthShare. So we have just learned then through this process that we have to pay for it out of our pocket, and then we turn in the receipt to Liberty HealthShare. So I think has been my only trepidation, is making sure it really gets covered. But so far in talking to people that I know that have had Liberty HealthShare, they haven't had any issues with that. So I'm kind of living on faith that it'll happen.
Sure. So you haven't been reimbursed for that yet?
Not yet. We haven't gone through that whole process yet. We have had a few things we have turned in, though, that haven't quite met our $1,500 unshared amount, and that has been processed and has been put towards that. And we have seen that, it show up as yes. So, that's being paid for it in a sense, because we have seen that. So once we get this ER bill turned in, I'm assuming it'll be the same. And when I called and talked to them, we were told, yes, you will be reimbursed for that. So.
Okay. So my understanding is that they also take kind of a proactive advocate approach to negotiating with some of the medical providers. Have you seen them actually negotiating a lower rate to be reimbursed through this method versus being reimbursed by a health insurance company?
I have not seen it myself. I have not had an experience with that, but I do know they do that. Now, if you're interested, and I haven't even talked to her, but I have another close friend that also utilizes Liberty HealthShare that's going through that process right now. She's going through that with a son who had a major leg surgery, shattered bones, last spring. And so they're going through that right now, where Liberty HealthShare is negotiating with that hospital.
I think we heard, but Dale Bellis did mention a catastrophic case out of Arizona, so this might be one of them.
Him. It probably is.
Yeah, we're trying to really give our viewers more of a kind of a bird's eye, macro view of what HealthShare is, and then of course provide them the information that they can. They can investigate for themselves. So I definitely wanted to.
So I haven't witnessed that, but I have spoke to somebody who is going through that right now.
Okay.
That negotiation process, yeah.
But so far the process, you feel you've been supported. It's been a positive experience thus far, with just this little hiccup of the hospital or the ER not being willing to bill them directly.
Yeah, so far
accurate?
Liberty HealthShare has been very supportive. They were really hoping that we could talk the hospital into billing them, just so that I didn't have to pay that much money up front. But it's kind of looking like the hospital's not going to work with us. So that's probably been the only drawback I've seen, is that I'm learning, okay, I just need to know my hospitals. I need to know my, even though, because nobody contracts. They don't contract with anybody.
Right.
But some places are willing to bill them, and some places say, no, we don't bill anybody we're not contracted with.
Sure. And do they issue you some sort of card that you can present so you can at least show them that you're, okay, so you have a membership card.
I have a card.
Okay. So I guess the hope is, in the long term, is that, these providers will understand, hey, this is going to be a claim that's going to be paid. We just would like it to be paid by, this HealthShare, and can you please, send them the bill and at least start the process, because, even an ER visit, that I can't even think of the last time I had an ER visit, but that's still pretty costly. And
right,
it
was, but it was one of those when a 3-year-old, you can't go, well, let me call around the hospitals and see if we, see who will take us. It was definitely an emergency situation, and so. It included a CAT scan and that's our CT scan, so that's why it was so costly. But it was really costly, and so I'm like, oh, not everybody has that kind of money to put out up front. So like you said, it's exactly that. The hope is that they become more familiar, so that hospitals aren't quite so afraid of them. Because I see that. Now, I did have a visit with an OBGYN who was super familiar with them and said, oh, yeah, we have no trouble. We bill them. And then they negotiate out the price, and then they let their customer know the price, and then the customer pays that, and then they reimburse the customer. So they had it all figured out in their offices. So it is possible for offices to figure it out, but in my experience, it's just been the hospital. And associated with the exact same hospital that we went to for the ER is MD Anderson Cancer Research Center, who won't see me. I actually am looking for a new oncologist just as a follow-up because of being a cancer patient, and because that's my only other negative, is they just said nope, like they won't even see me as a patient. So I think like you said, it's just more about hoping that it gets out there and they understand, and the hospitals understand that this is going to be paid, and if they can work with patients a little bit more on it.
Gotcha. So to wrap up, and I'll just mention this to you, and you can see it when on, the broadcast as well, but, we did kind of explore some numbers, and Mr. Bellis did explain to us that there's $25 million of HealthShare going on within his organization every month, which I thought was a great number, and of course
wonderful.
They don't quite have 100,000 members, so that's very positive, and he thinks by 5 years from now that they should have close to 1 million members in the HealthShare,
which I think would be wonderful.
Yeah, that's what I asked him. I said, one of the first questions was, hey, could a catastrophic situation shut you down? And he basically said the way that they have it organized is that not really realistic, because if they did have something major that they had to get covered, then they would have to ask for more, cash or whatever from their members, or like a temporary increase, right? But
right.
But when you're talking about 90,000, plus members, probably not a significant amount would have to be increased. But but I'm anxious to see how promising. That. Yeah, and this, it's something that all employers are kind of looking at is, there's the traditional health insurance offering, but is there something better? And of course, in my life, in our family, we do a lot of natural, cures as well. And so, it'd be nice to couple that with something and become what what one of my other guests called an engaged healthcare consumer. Is that, and instead of just kind of rolling over and saying, well, this is the insurance company's way of doing things, that you can actually educate yourself and learn more about, these health shares or other programs that might be good for people. So
yeah, I love it. I think so far in my experience, even when I talk to people, they're like that, or when I talk to their customer service, you're in charge. You're in charge of your own health care.
Sure.
The insurance company isn't in charge of you. And with insurance companies, they're in charge. They decide who you can see and what you can see them for. But with Liberty, they say you can see whoever you want to see for whatever you want to see it for, and then send us, the receipt. And, and I like that because I want to be in charge of my own health care.
Sure. A great alternative for sure. Well, Sarah, thank you so much for spending a few minutes of your time with us. And we wish you and your family the best in your health care, okay?
Thank you. Have a great day, Steve.
All right. We'll talk to you soon.